We can see here we've got a posterior medial meniscus root tear with instability. It's reasonably well reducible. It's not significantly pulled off of its anatomic attachment. And the goal here is going to be to create a anatomic posterior medial meniscus root repair. And when we're evaluating these meniscus root tears, what we will notice is that a non-anatomic root repair does not completely restore the normal biomechanics of the knee. So making sure that we maintain and obtain an anatomic repair is of utmost importance in these situations. So now we're viewing the posterior medial meniscus root, and you can see the normal anatomic attachment is right here posterior to the tibial spines. What I will typically do is take an RF device and place it into the anatomic position of the meniscal root, create a small mark for myself that will allow me to place my guide in the position that is desired, and typically it's right in the anatomic location of the typical meniscus root attachment. I'm now introducing the medial meniscus root repair guide, and ideally we want to hook this on the back of the tibia adjacent to the location of the meniscus root tear. Hooking this on the back of the tibia allows us to see the marks and for placement of the guide in a position such that we can restore the meniscus anatomically. In this case, it looks like we're going to be using the 5 millimeter position to restore the normal anatomy. During a meniscus root repair, I will typically utilize a 3.5 millimeter drill pin as a guide prior to introducing the flip cutter. So now that I've introduced the 3.5 millimeter drill pin as our guide or our track to create the anatomic root repair, I'm introducing the flip cutter, which will go through the same track that we've just previously drilled with the 3.5 millimeter pin. So this should easily pass up into the exact same location that we had just drilled. So now that we have our flip cutter introduced, we're leaving it just off of the bone. And what we want to do is create a decortication and submerge or create approximately a 5 millimeter socket here so that we can dunk that meniscus root into the anatomic position. Now that we've done that, I'm deploying the flip cutter back and removing it from the joint. Now that we've established that, we've placed a passport in our anterior medial portal, and we're going to place our 0.9 millimeter fiber tape link through that passport into the posterior medial aspect of the meniscus and perform our meniscus root repair. Now that we've passed our suture through the meniscus, I'm going to place the free end into the loop, creating a luggage tag style suture, which can then be pulled through our passport and into the meniscus, creating our first luggage tag style suture. One of the tricks to ensure that we're not tangling our sutures is we can actually sort of move this out of the way at times utilizing a probe. In this instance, I don't think it's going to get in our way, and we can shuttle it one way or the other to get our second suture, but that is a trick that you can use to make sure the stitches stay out of the way. Another trick that can be done for this case is to actually place the fiber tape link around the shaft of the Scorpion device such that when you pass the suture and pull out the shaft of the device, as you withdraw the shaft, it actually creates the luggage tag suture for you, saving a step. Now we're introducing our second luggage tag suture into the joint. We can place that on either side of this meniscus, but in this case, I think right there is appropriate. We'll pass our second luggage tag. Now that we've got our sutures passed, I'm going to feed the wire up into the joint and utilize a grasper to pull our wire out of our anterior medial portal through the passport. This will allow us to shuttle the sutures down our previously drilled tunnel. Both of our luggage tag sutures are outside of the joint, and we're going to pass these through our suture lasso such that they can be shuttled down the tunnel. Once we've got our sutures passed, one of the tricks that we can use to make sure we have an anatomic reduction of our meniscus is actually to loosen this up and pass it around the end of the meniscus and have our assistant tug on that meniscal suture in order to reduce the meniscus back to its anatomic position. And we can do this with both stitches actually, so that we've got a vector of pull that's down the tunnel, reducing our meniscus anatomically. So you can see that by doing that, we've got our meniscus anatomically reduced into its footprint now. Once we've got our sutures fixated, we can pull our guide sleeve and we can tug upon our sutures and ensure an anatomic reduction of our meniscus root, which is occurring here. Once we've passed our sutures out of our anterior medial drill tunnel, we're going to place our drill for the 4.75 millimeter swivel lock and ensure we are not entangling our sutures and drill down, creating our pilot hole. Following tapping, we'll place our sutures through the end of our 4.75 millimeter swivel lock and place that into the previously drilled hole. We can see that we've got our meniscus reduced anatomically, and we can now secure our 4.75 millimeter swivel lock against the anteromedial tibia, securing our fixation construct. I'm now going to introduce our fiber stitch through the portal skid such that we can place our meniscus repair in the posterior medial meniscus. Now that we have our implant deployed, I'm going to actually grasp all of the sutures in the implant and give them a slight tug, which can deploy the meniscal implants against the posterior medial capsule and ensure that the slack is out of the system. I'm now going to take a probe and place it into the meniscal loop such that we can tighten the meniscus against the posterior medial capsule. Now that we've tightened our first loop, I'm going to bring the probe out of the system and pull on the free end of the suture, reducing the second loop. Following placement of our suture, we'll introduce our knot pusher cutter, which can further reduce the meniscal loop, and then cut the suture. And you can see when we probe the meniscus, we still have relatively normal excursion, an excellent fixation of our meniscus root such that it will not displace from its anatomic position.